Welcome to the deep dive. Today, we're embarking on a journey into a concept that's, well, truly reshaping the landscape of medicine, the 360-degree patient view. Our mission in this deep dive is really to explore how all those scattered pieces of health data can finally be woven together, how they can tell a complete holistic story of an individual's entire health journey. We're going to try and understand why this view is so transformative, how it's technically constructed, the unprecedented insights it unlocks, and just as critically, the profound responsibilities that come with it.
Absolutely. And, it's not really an exaggeration to say that the reality of healthcare today often feels like a fragmented puzzle. Patient information is siloed across countless systems. And bridging those gaps, that's honestly one of the biggest, most urgent challenges we face. Getting this right is fundamental.
Yeah, fundamental to improving outcomes and efficiency. Let's maybe unpack this with a relatable story. Imagine someone, let's call her Sarah. Sarah sees her primary care physician for a checkup, okay? That creates one set of valuable medical notes.
Right, one piece of the puzzle.
Then later, she gets a referral to a cardiologist. That adds a whole new chapter to her record. She might then undergo a procedure at a local hospital, generating even more detailed data.
Another silo.
Then she picks up prescriptions at her local pharmacy, and of course there's all that continuous data streaming from her smartwatch right there on her wrist. So each of these interactions produces crucial data points, EHRs, pharmacy data, wearable insights.
Valuable data, but disconnected.
Exactly, that's the core problem. All these chapters are currently stored in different systems, often in different formats. They can't talk to each other. It's as if Sarah's health story is scattered, pages in different archives, maybe even written in different dialects.
And no single doctor gets to read the whole biography. They just see isolated chapters.
Yeah.
And the real-world consequences of that data fragmentation are, well, they're far-reaching. We miss critical insights, which can lead to delayed diagnoses or interventions that, frankly, could have been proactive.
Makes sense.
And think about the sheer inefficiency of redundant tests. A patient might get the same MRI multiple times just because different providers can't easily access the previous results.
Wow. Yeah.
Ultimately, this creates significant gaps in care, and that directly impacts patient outcomes and, of course, healthcare costs.
So the big question becomes, what if we could bring all those scattered pieces together? What if we could collect all those chapters from all those different sources and weave them into one single coherent, a 360-degree view of Sarah's entire health journey?
That's the vision. That's the transformation we're talking about.
It reminds me, if you're trying to understand a complex movie, relying on just one character's scenes just won't cut it. You miss the plot, the context.
The connections, yeah.
A unified 360-degree view changes all of that for healthcare.
Indeed. And the first really profound benefit is holistic patient understanding. For the very first time, this complete view lets us see the full continuum of a patient's health journey.
The whole story.
Exactly. Think of it as this rich, continuous narrative. It's populated by every significant life event, childhood vaccinations, maybe that sports injury from college, any environmental exposures they've had, and, of course, chronic diagnoses later in life. It's a complete picture over time, not just isolated snapshots.
So for Sarah, her cardiologist wouldn't just see her current heart issues.
Right. They might also see, say, that sports injury from 10 years ago, or notice a pattern in her smartwatch data that correlates with her fatigue, things you would otherwise miss.
Okay, what I find particularly fascinating here is the ability to identify complex interactions. This is where it gets really interesting, I think.
It really does.
With all that information linked and speaking the same language, we can discover things we just never would have seen before. Like, the sources highlight how this comprehensive view allowed researchers to find that patients taking a specific combination of two, common drugs,
Two seemingly unrelated drugs, yeah.
had a significantly increased risk of an adverse outcome, something you'd never spot otherwise.
That drug interaction example is incredibly powerful. Before this kind of 360 view, identifying a subtle, dangerous interaction like that was often a years-long retrospective process.
Right, needing big trials, maybe.
Exactly. Large-scale clinical trials looking back. Now, we're talking about potentially flagging these risks in near real time, maybe even for individual patients.
Wow.
That's the difference, you see, between reactive medicine and truly proactive preventative care at scale. It's a fundamental shift in how we approach drug safety.
And that ties directly into the third benefit, enhanced predictive power.
Precisely. With a more complete picture, our ability to anticipate future health events just improves dramatically. You have these advanced AI models processing incredibly diverse data, genetics, EHRs, lifestyle stuff.
All of it together.
All of it. And they can output highly accurate future risk scores, informing proactive care. We can move from just reacting to illness to genuinely predicting and ideally preventing it.
And let's be honest, efficiency matters too. The fourth benefit, eliminating duplication and improving efficiency.
Oh, absolutely. And it's pretty straightforward. When a new physician can access a patient's complete history directly from that unified view, boom, you avoid redundant MRI scans or unnecessary blood tests.
For Sarah, that means no more repeating her entire medical history at every single new specialist's office.
Exactly. It saves time, it saves money, and frankly, a fair bit of sanity for everyone involved.
And finally, a benefit that really hits home for the individual, empowering truly personalized care.
This is the ultimate goal, isn't it? This complete picture allows clinicians to tailor interventions based on an individual's unique data profile. We move beyond those one-size-fits-all approaches to truly customized treatment pathways.
Making sure treatments are precisely right for that person.
Based on every detail of their health story. Imagine Sarah's doctor crafting a wellness plan specifically for her, factoring in her genomics, her lifestyle, even her environmental exposures. That's personalized.
Okay, so how do we actually build this? Constructing this 360-degree view sounds like building a really complex mosaic. You need all these different types of data.
That's a great analogy. It really is like assembling a mosaic piece by unique piece. The foundational layer, sort of the bedrock, is clinical data.
Right, the medical stuff.
Exactly.
Yeah.
Electronic health records, specialist reports, and critically, patient-reported outcomes, PROs, those quality of life surveys.
How the patient actually feels.
Precisely. And patient-generated health data, PGHD, like that continuous data, streaming from smartwatches, syncing to a phone app, that's all clinical.
Okay, layer one. Then we have the next crucial layer, administrative and claims data. What's that about?
This gives you a broader view of a patient's interactions within the whole healthcare system. It includes things like insurance claims, maybe death registries. It gives us a look at how and when services were accessed, what treatments were covered, sort of the logistical footprint.
Got it. The system interactions.
Then moving deeper, we get into the biology. Genomic and omics data. This provides insights into an individual's DNA sequencing, proteomics, that's the study of all proteins, and metabolomics, studying metabolites involved in metabolism.
That sounds cutting edge.
It is. And as of, August 8th, 2025, this data is becoming increasingly central. It offers incredibly personalized biological insights right down to the molecular level.
Wow. Okay, and finally, you mentioned context, the social and environmental data layer.
Yes, absolutely crucial. This includes things like geospatial data where you live and socioeconomic indicators. We're talking about data like local air quality, the presence of food deserts.
Food deserts.
Yeah, comparing grocery store availability versus, say, fast food options in an area. And even things like the locations of parks within a de-identified residential neighborhood.
Huh. I wouldn't have thought of that as health data.
But these external factors can profoundly influence health.
Yeah.
Often in ways we're only just starting to really understand and quantify.
So you bring all these together, the clinical, the admin, the omics, the social context.
Exactly. And collectively, they create that truly comprehensive, multi-layered picture. It's no longer just a medical chart. It's more like a living mosaic of their life and well-being.
So, okay, we have all these pieces. They're coming from totally different systems, different organizations. How do we actually perform this magic of linking the data sets together? And maybe more importantly, how do we do it while rigorously protecting patient privacy? That seems like the big challenge.
It is a huge challenge, but there are methods. There are two primary linkage approaches. First, there's deterministic linkage. This method is quite precise. It uses a unique stable identifier, maybe like a national ID or something similar to snap records together directly.
Here's like a perfect match.
Exactly. A one-to-one definitive match.
Yeah.
It's clean when you have that unique ID. The second is probabilistic linkage. This is what you use when those unique identifiers aren't available across all data sets.
Which must happen a lot.
Oh, frequently. So it relies on common but non-unique identifiers, think date of birth, maybe parts of a name or address. And then it employs sophisticated statistical algorithms to calculate a match probability, say 98% certainty this is the same person before linking the records.
So it's based on likelihood.
Right, finding the highest probability of a match while accepting there might be a tiny degree of uncertainty.
Okay, but linking based on date of birth, that still feels like you're using personal info. How do you protect privacy during that?
That's where techniques like tokenization or hashing are absolutely crucial. They're key to doing this safely. Here's kind of how it works. Personally identifiable information, PII like Robert Smith, SSN 123456, is taken.
The sensitive stuff.
Exactly. And it's passed through an irreversible hashing algorithm. Think of it like a one-way blender. This produces an encrypted, anonymized string, a token, like token, 0 by 2 JD9K.
Which doesn't look anything like the original name or number.
Not at all, but the same name and number will always produce the same token. So this token allows records from different places to be matched if they belong to Robert Smith, but without ever revealing the original sensitive PII during the matching process.
So you match the tokens, not the names.
Precisely. The original data is never exposed in that linkage step. It's like matching puzzle pieces by their unique shape without ever seeing the picture printed on them.
Clever.
And these linkage processes, they often happen inside highly secure environments called secure data enclaves. Think of these as digital fortresses or clean rooms.
Okay.
Raw data goes into these enclaves for linking and analysis. But crucially, only anonymized summary information, maybe a simple bar graph showing a trend across thousands of people, is permitted to exit.
So researchers never actually see the individual raw data.
In many setups, no. They get the aggregated insights, the patterns, the results of the analysis, but not the granular, identifiable data points within the enclave. It's a powerful safeguard.
That makes sense. But wait, before you can even link or tokenize, don't the different systems need to record things the same way? Like, what if one hospital calls it high BP and another calls it hypertension?
You've hit on a critical prerequisite. Data standardization. Absolutely essential. You need to ensure all the puzzle pieces actually fit together, that they, speak the same language.
Otherwise, the linking is useless.
Totally useless. That's where things like common data models, such as BOMO-P and data exchange standards, like FHIR, become vital. Think of it like this. Those standards act like a universal dictionary. They take disparate terms like DX hypertension from one system and condition, high BP, from another,
And translate them.
and convert both into a single, consistent, standardized code, say, condition, SNOMED CT 383-41003 for hypertension. So when you bring the data together, it's perfectly compatible and meaningful for analysis. Without that standardization, even with perfect privacy protection, the linked data just wouldn't work.
Okay, wow. So assuming we can do all the standardization, the secure linkage, the privacy protection, this is where the profound impact truly comes alive, right? The real-world applications.
Yes. This is where it gets exciting. The applications of the 360-degree patient view are genuinely transformative. We can talk about maybe 5 key areas where this unified view is already making a difference or has huge potential.
Let's hear them.
First, precision medicine. Imagine a doctor pulling up your complete health profile, genomics, lifestyle, full history, right there on their tablet. Instead of a standard generic treatment plan, they see a personalized, maybe even color-coded plan, unique to you.
Tailored specifically.
Truly tailored based on every nuance of your data. That's precision.
Okay, number 1. What's next?
Number 2, drug safety. We touched on this, but with linked data on a massive scale, AI can identify rare side effects much faster. It does this by detecting faint red signals, these subtle patterns emerging from maybe small, scattered groups of patients within a vast global data set.
Things you'd miss in smaller studies.
Exactly, flagging potential issues much faster than ever before. This could prevent serious adverse events for countless individuals.
Huge potential there. Number 3.
Public health. Imagine real-time data streaming in from hospitals, pharmacies, labs, all feeding into a central command center. This empowers public health officials to track and hopefully contain an outbreak effectively. It gives them unprecedented situational awareness.
Like for a pandemic or even just the flu season.
Precisely. Reacting quickly to developing situations based on real-time, comprehensive data.
Okay, number 4.
Improving healthcare quality. Data analysis, powered by this 360 view, can help streamline a patient's entire journey through the system. It can help transform what might have been a jagged, inefficient path, repeated forms, delayed handoffs into a much smoother, more coordinated and cost-effective one.
Optimizing the patient experience itself.
Yes, making it less fragmented and frustrating.
And number 5.
And finally, a very practical application, fraud detection. With linked data, an automated system can quickly spot patterns,
Mm.
Multiple suspicious bills, maybe with red flags, coming from different locations, but all pointing back to a single patient ID.
Ah, connecting the dots.
Exactly. It instantly triggers a system alert for potential fraud. Makes it significantly harder for bad actors to operate unnoticed.
Okay, those are some powerful applications.
But
This journey towards a 360-degree view, as we're learning, it definitely comes with immense responsibility. The sources make it clear we're navigating, well, a real minefield of ethical, legal, and social challenges.
that's a good way to put it. A minefield that needs very careful navigation.
Well,
First and foremost, as we discussed, is privacy. This demands those sophisticated de-identification filters, really robust methods to blur and pixelate personal info, ensuring individuals can't be re-identified from the data.
non-negotiable.
Absolutely. Then there's security. We need state-of-the-art security. Think of it like a strong, glowing shield around the data servers.
Yeah.
It has to be strong enough to repel incoming cyber attacks aimed at this incredibly sensitive information. The stakes are enormous.
Right. And beyond the tech, what about people?
That brings us to public trust. It's absolutely crucial. We need to foster trust and engagement within communities. People need to understand how their data is being used, that it's genuinely for societal benefit, for their benefit. Transparency and active communication are key. Otherwise, trust erodes fast.
And the legal side.
That's complex too. You're balancing different regulatory frameworks, like HIPAA in the USA versus GDPR in the EU. They have distinct requirements for data handling, consent, and cross-border data flow that must be carefully navigated. It's a legal patchwork.
Okay, and one more big one. Bias.
Yes, the critical challenge of equity and bias. This is so important. If your data sets are composed disproportionately, say 90% of one demographic group and only 10% of another, any algorithms trained on that data can inherit and even amplify those biases.
Leading to skewed results.
Exactly. Skewed bias results. This underscores the absolute necessity for building balanced representative data sets. We have to strive for that to ensure fair and equitable outcomes for everyone, regardless of background.
So the tech solutions are powerful, but they aren't enough on their own.
Not even close. Technological solutions are only part of the answer. They absolutely must be paired with strong ethical oversight, robust governance structures, and that meaningful public engagement we talked about. Think of them as maybe three interlocking gears. Technology, ethics, and engagement all working together seamlessly to ensure this powerful capability serves humanity responsibly.
It's clear this journey towards a 360-degree view of patient health represents a really fundamental shift in how we approach healthcare. It seems essential, really, for delivering the better, more personalized, more proactive, and crucially, more equitable healthcare that I think we all strive for. We've explored how that fragmented data can coalesce into this complete, almost glowing 360-degree view around a person transforming care.
And if you connect that to the bigger picture, it really means moving beyond just treating symptoms. It's about understanding the whole person, their history, their biology, their lifestyle, their environment, across their entire lifespan. That's a profound change in how we even think about well-being. It's moving towards a truly holistic model of health.
So here's something maybe for you, our listener, to think about as this technology continues to advance. What are your thoughts on balancing the immense potential benefits of linked health data, the precision medicine, the better public health, with that critical need for individual privacy and data security? It's a complex balance, and it's a question that will definitely continue to shape our future. Thank you so much for joining us on this deep dive. Stay informed, stay engaged, and let's all think about how we can contribute to a future where healthcare is truly connected for everyone.